Okay, so thank you. In the essential tremor treatment, we usually start out in the alignment phase of the treatment, aligning in the phase and code direction in all three scan planes. And so we'll align in the phase and code direction, we'll swap phase and frequency, and align in the phase and code direction in the swapped image. This is very time-consuming to do the multiple images swapping phase and frequency. It's about 4 minutes every time we do that extra sonication swapping phase and frequency. But more importantly, it's artifact-prone when phase is in the SI direction. So you can see here, there's some aliasing artifact from the vessels down in the neck that's coming around here, and an interference pattern. You can't just swap scan planes in order to get around this artifact, because here again phase and code is in the SI direction, and we see still that there's this aliasing artifact from the body that's coming up and aliasing in there, and it comes through in the temperature map. So you can see the artifact here, and then over where we're sonicating there's artifact as well. So the reason why we do this, why do we align in the phase and code direction, is because we use a kind of a longish echo time. There's a lot of time for sampling our signal, and we want to maximize our signal to noise, so we use all of that, and we use a low bandwidth to do that. Because we use that low bandwidth, we potentially could have spatial shifts. If you had a 60-degree temperature rise, it would give you a 30 hertz off resonance and a spatial shift of about 0.7 millimeters. So that's why we don't typically align in the frequency and code direction. But more recently, there's been a multi-echo sequence that's become available. And so the idea of the multi-echo is that you use multiple high bandwidth acquisitions, and then you can put them all together into one temperature map. And because you use the high bandwidth now, the spatial shift is much less, so that its worst case scenario of 60 degrees would give you only 0.1 millimeter spatial shift. So in theory, this is going to, because you're sampling almost the same time as a single echo, it's going to, in theory, give you almost the same signal to noise. So theoretically, there's a little bit of time that's lost with the refocusing and about 11% lower signal to noise. So the purpose of this work was to ask how the multi-echo sequence compares in practice. So what are how does the SNR compare in practice and the artifacts? And then the important question of, can we simply align in both directions in the same image? So my methods are shown here. I process the images using single baseline subtraction followed by referenceless processing, where I used a frame region of interest. There's some more details given here. I looked at the standard deviations in the frame, and I looked across 6 patient data sets that were acquired with a single echo only, 4 that were acquired with a multi-echo only, 1 that had both single echo and multi-echo, and for a total of 2,000 images. So the results are shown here of the signal to noise of the multi-echo compared to the single echo. In theory, the patient that had both, and then averaged across those 2,000 images, and you can see that in theory, across all the images, it compared very well. If we split it out, however, and ask what was happening in those images where the phase and code is in the SI direction, we see that the multi-echo actually does better than the single echo did. And it's just because of the same reason that I showed you, that there's these artifacts in the single echo that are not coming across in the multi-echo. It's a much cleaner image here. Now, again, phase and code is this way, much cleaner image. It's because it's flow compensated and there's lots of averaging. If you look at the same scan planes, but now when the phase and code is, so this is a frequency and code direction now that it's shown right here. Now phase and code is not in the SI, and you can see that it compares very well with theory. Okay, so now that question about can we align in both directions at the same time? So what we see is our spatial shifts from that theoretical 60-degree temperature rise are going to be much reduced. Are there other reasons why there could be spatial shifts in the frequency and code direction? Because we have those multiple echoes at different echo times, we can make field maps and quantitate what the off resonance is and what the spatial shift would be from that. So that's what I've done here, where in 703 images across the patients that had the multi-echo images, I acquired the field maps, and in all of those images, I looked at 3x3 region of interest around the target and quantitated the off resonance. And the results are shown here for our 4 different patients, split out into the different axes. It's not really very interesting. The only detail is really what's the maximum extent in the off resonance, and what we see is in one patient it went as high as 88 hertz off resonance. So that was a shift of about a third of a pixel in the frequency and code direction, and because the spatial resolution in phase and code is half that, it's about a sixth of a pixel in terms of what we're aligning in phase and code. Okay, so in conclusion, the multi-echo is much improved over this single echo in terms of SNR when phase encode is in the SI direction. The artifacts for the multi-echo are significantly reduced over the single echo when phase encode is SI, and the spatial shifts are significantly reduced. They're observed to be less than 0.3 millimeters in frequency encode in our 4 subjects. So the bottom line is this: there's 3 different options. We can keep the single echo and have artifacts that look like this, and I'm hard-pressed to think why we would want to do that. The second option is to use the multi-echo and continue to swap phase and frequency. So it uses about the same time as we have now, but we have better quality images, especially in the image where the phase is SI. And then the third option is to line in both directions at the same time in just the one image where phase encode is in the AP direction on the sagittal. So this would save time. We could give better resolution for that alignment, and you could potentially see shifts as much as 0.3 millimeters, which is a fraction of a pixel. So thank you very much for your attention, and I'd like to acknowledge my grant support.
We have time for questions. So I have a question. How much time do you think you'd save in a treatment if you would use this approach?
So I looked back to see how much time we were spending when we swapped phase and frequency, and it's about 4 minutes each time. So if you're doing that in the 3 scan plane, you save about 15 minutes.